Hello, hello. This is Dr. Ina here with you at Digestive Reset. And I'm here to talk about an important topic, as always. I am a functional medicine practitioner, doctor of pharmacy, and I've been practicing functional medicine with clients that have Crohn's, colitis, chronic fatigue, chronic hormone problems for over 14 years. And I've created a digestive reset signature program that I have been improving for years to perfect it. And I'm going to talk about today, why is it important to get an anti-inflammatory herb or supplement for IBD, inflammatory bowel disease, and which one is for you? That's even better question, because not all of the supplements or, as you know, medication is for everyone. What could work for one doesn't necessarily work for the other. The individualized approach has always been what I preach. For the disclaimer, this information is not medical advice. Follow the advice of your healthcare practitioner while consuming our content. So let's dive in. I'm going to mention most of the nutraceutical supplements or vitamins that are currently used, only the ones that actually have some data. Most of these have poor data, of course, comparing to pharmaceuticals where really big trials have been conducted in order to come up with good conclusion, good statistics, biostatistics to prove the outcome. We don't see as much of that with nutraceuticals, natural supplements. Nevertheless, we do see good data now, way better than I originally started when I started functional medicine. So I'm going to share those with you. While I'm sharing this information about supplements, which ones and what's good and what's considered studied and with beneficial effect, it doesn't mean that the supplement is specifically for you. And there are many reasons, but let's start with the first one that I'm going to discuss, colostrum. Colostrum is a wonder supplement for immune system support. It's a natural anti-immunoglobulin. Colostrum provides perfect combination of immune and growth factors, including immunoglobulins, lactoferrins, insulin-like growth hormones 1, IGF-1, and colostrum transfer factor. It also provides the perfect blend of amino acids. I talked about amino acids on another talk in my videos, and other natural immune boosting properties. Now, when we discuss colostrum and how great it is for you, and it's a really great supplement, especially with kids when that need immunoglobulin support. What could be an issue is a severe sensitivity to dairy, because colostrum is a dairy product. It doesn't happen, the reaction doesn't happen with everyone, but the reaction does happen. And talk to your healthcare provider, talk to the one that possibly checks your food sensitivity, and see if that's the right kind of support for you. Another supplement that is considered useful, beneficial in studies is bovine-derived IgG immunoglobulin. The discovery that the gut barrier plays a key role in immune system health fueled the search for this to strengthen it. In that search, researchers found that the binding capabilities of immunoglobulins have a positive effect on gut barrier function, like to protect the gut lining. Immunoglobulins bind microbes and toxins in the GI tract and eliminate them prior to immune system activation. So like those soldiers come in and protect. As these unwanted triggers are removed, it resets healthy immune tolerance and builds a stronger barrier to the external environment. So these have been helpful for Crohn's and colitis patients. They have been helpful for those with general chronic inflammatory conditions and chronic inflammation in the gut without even IBD. And again, if we are to choose between, let's say, colostrum and IgG bovine-derived IgG immunoglobulin, those with dairy sensitivity would probably be better candidates for this type versus colostrum. Again, this is something to figure out with your practitioner, yet this is definitely a good option, well researched by now. Turmeric is very common now. It's used in golden milk in coffee shops. Turmeric is used in a combination of products. Turmeric is a wonder anti-inflammatory supplement, and it's a yellow spice from a ginger family, believe it or not. And curcumin is an active ingredient in turmeric. Researchers show that curcumin is an anti-inflammatory, possibly inhibiting COX-2, prostaglandins, leukotrienes, and other cytokines, just like really heavy-duty pharmaceuticals. In a small study shows that taking curcumin 1.08 grams daily for 1 month, followed by 1.44 grams daily for another month, decreases diarrhea and stomach pain compared to baseline with patients with Crohn's. So we do have beneficial effect of turmeric for Crohn's patients, and some research using curcumin in patients with ulcerative colitis, not to the same detail, but the clinical study shows that taking curcumin 1.1 grams per day for 1 month, followed by 1.65 grams per day for another month, decreases symptoms of ulcerative colitis in patients taking mesalamine and corticosteroids compared to baseline. So we're actually comparing two medications here. Again, is it for everyone? Absolutely not. Couple of reasons again why. Sensitivity, allergy reaction, people with hormone issues. We see women having issues with their periods once they start turmeric. Definitely consider speaking to your healthcare practitioner and consume this as for information use only. Andrographis, great supplement, has immunomodulating properties. Andrographis inhibits tumor necrosis factor, alpha interleukin, IL-1 beta, and nuclear factor and FKB, providing that it has proving that it has anti-inflammatory properties. In a small trial, Andrographis was taken with an extract of 1.2 grams to 1.8 grams for 8 weeks to decrease the symptoms mild to moderate colitis compared to placebo. And more research is to come, but the agent is looking promising. Again, this is used as one of the ingredients in immune system supplements, and it has shown some benefit. L-glutamine. I talked a lot about L-glutamine when we discussed amino acids in that video, but it cannot be omitted in this one. L-glutamine is essential, is important amino acid, and used in Crohn's, used in colitis. Depletion of L-glutamine can result in the damage of intestinal lining. There is some data showing evidence that glutamine affects GI cell proliferation and differentiation, and more studies are needed, yet we do see beneficial effects for that straining of the intestinal lining. Boswellia. So many questions I received about that supplement and the studies on ulcerative colitis. Boswellia contains anti-inflammatory agents, boswellic acid and alpha-boswellic acid. Some data indicates that Indian frankincense gum resin, which is pretty much what Boswellia is, 350 milligrams of it 3 times a day, might induce remission of ulcerative colitis. That's big. When we mention remission, we don't like saying things like that with colitis and Crohn's. It's a chronic condition that currently does not have a cure. Yet, considering Boswellia for some patients can make sense. It's a potent anti-inflammatory. Again, we see some disruption in the microbiome in some patients with it. We see some hormone issues. Small percent of women can have that. Nothing is without a problem. Yet we see a tremendous benefit for others. Phosphatidylcholine. It's a phospholipid that can be derived from soy, sunflower, mustard, and eggs. And it's thought to be also anti-inflammatory. It has anti-inflammatory effects and colon protective effects. Clinical research suggests that taking slow release of phosphatidylcholine-rich phospholipids, 6 grams per day for 3 months, improve the rate of remission and improves the symptoms compared to placebo in patients with colitis. Glutathione. A lot of talk on glutathione or NAC, which is the precursor. Glutathione is a very important antioxidant. It's abbreviated as GSH. Glutathione is a type of a small protein that is essential to your health. Living organism could not survive without GSH. Some amino acids are needed to make GSH. Those glutathione precursors called glutamic acid, cysteine, and glycine. One common natural supplement that many Crohn's disease patients take is called NAC, N-acetylcysteine, which is derived from an amino acid called L-cysteine. Taking the supplement can increase the levels of GSH, but there are other great products available that improve GSH levels as well. It's also it's almost impossible to boost the levels of glutathione by eating certain foods. So to get what you need, you often even need not just foods, but supplements, and from a trusted source. Don't forget, it does matter where you buy your supplements and who's the source, and testing on the supplements is very important. Some labs are not of the same quality and the same efficiency, and it does matter what you are buying. Just like with food, cleaner option or not such clean option. There's research literature available on PubMed on glutathione. If you want to learn more, there's a lot of interesting studies there. So again, why is it important to get an anti-inflammatory herb or supplement nutraceutical for inflammatory bowel disease, for chronic inflammatory conditions, for chronic inflammation in the gut? You get better calprotectin levels. And I talked about calprotectin in yet another video, marker for inflammation and IBD patients. It's a really interesting marker to monitor. It also, they reduce signs and symptoms. They help with better absorption. They help with more energy. Of course, there are interactions. The more of the things you're taking, there's drug-food interaction, drug supplement interaction. Find a healthcare provider that is very familiar with all this and able to help you figure out interactions. And don't start anything new until you discuss it with your provider. Again, this is Dr. Ina, Digestive Reset here with you. If you find this information helpful, I'm going to hold a really interesting webinar on August 23rd, 5 mistakes to avoid while you're healing your chronic gut inflammation with IBD or without. Please register. The sign up is right below the video. And I'd be happy to see you there. We will be discussing those 5 mistakes, and that will help you to avoid, because there's a lot of shiny, bright things you could reach for. Here's a new thing to try. Here's that to try. Is it really for you? That's a bigger question. I am going to be excited to see you there. And until August 23rd.